want to talk about applying skin glue. And I'm going to use Dermabond just because that's what I'm used to using, but there are, I'm sure, other products on the market that are just as good. First, let's set you up a little bit for applying it, and then we'll talk about how to apply it. So we use the Dermabond on all our trocar sites. We use a deep dermal because you don't want just the Dermabond. That's not really strong enough. If there's enough pull on it, it would pull it open. So we do deep dermals to approximate pretty closely. And if then we use the Dermabond on top of that. And if it's not 100% aligned, what you do is you do that counter traction that I've talked about in other videos, that you actually pull on that skin incision on the abdomen or wherever the trocar site is in order to get the skin edges to meet nicely. Once they meet nicely, and you've washed it off so it's clean at this point, once it meets nicely, you want to have your lap pad or a Raytech available so that you can put that on and blot it dry while you're holding it. Blot it until you're ready to do the Dermabond. So it will be as dry as possible when you're applying that Dermabond. Then the secret for applying the Dermabond is to put a nice thin layer, and I learned this from one of the doctors that I've worked with. If you put a nice thin layer on it, you accomplish two things. First of all, if you're holding that incision to keep it aligned, it will dry. You put that thin layer on, it will dry very quickly, and you don't have to hold it as long before you move over to the other one. And then you can go back and put a second thin layer on all of them, and they'll still dry faster than one thick layer that's going to drip. So it's drying faster, so you don't have to hold it as long. The other advantage to it, is that if there's a very slight ooze, it will actually dry fast enough that it will stop the ooze. If you have a brisk bleed, then you're going to have to go and find where the bleeding's from. And if it's like a 5-port or somewhere where you can't see the bleeding, then you're probably going to end up having to put an interrupted mattress, horizontal or vertical, to catch that bleed or to stop it. So we're saying we're doing the Dermabond. You're going to take that Dermabond, and I'm used to two different ones. There's one that looks like a pencil that you crack, and I like to just bend it at the tip and you can hear it crack. I like that one because there's lots of Dermabond in it, so there's plenty to use on multiple incisions. Your only limiting factor is that you have a certain time limit before it sets up, and then you can't get any more out. Or you have the little crack vials about the size of the Mastisol, this big, and I find that Dermabond is not as thick and doesn't hold as well as the one in the pencil type applicator. So now we're actually going to talk about putting it on. So you're putting it on, and say this is the incision. You've cracked it, you've cleaned your incision, you have a dry lap on it, you've put the stretch on if you need it, and then you just have a drop and you put a real thin layer and you spread it. You don't want to push too hard or you're pushing it away from the edges of the incision. So you just put a thin layer on and you spread it around, give yourself margins all the way around. Then go on, hold it till it dries, go on to the next one, start doing that one, and then come back and put a second layer. You don't want to have those blobs, because if you have those blobs, then they dry with these blobs on them, and then that's something that is irritating to the patient, and you feel a foreign body or something that doesn't belong there that's a bump and you want to pick it off. So there's no reason to have those drippy blobs hanging on it. Now, you might find that if you're putting a thick layer on and there's an ooze, it's going to take a while for that Dermabond to dry. And in the process of drying, the oozing continues, and it continues through it, and then your Dermabond gets all bloody. And then sometimes you might even find that the Dermabond dries and you're still getting that ooze through it because it hasn't sealed in that area. If you have an ooze, it's not sealed, you need to put some more Dermabond. So you want to get that Dermabond on thin so it can stop that oozing. The other thing I found is, used to have the Dermabond sometimes would get this frothy pink bubbly stuff on it, and I wasn't sure what it was. I finally figured out what I think it is. When I use a local in the incision, if it's bleeding through the incision site, the local is reacting with a Dermabond and making this frothy pinkish foam that dries, and it dries kind of ugly too. So you want to be sure that you have that blotted nice and dry just before you put that Dermabond on. And it really does do a very nice job.